I'm Dr. Lora Shahine. Welcome to my YouTube channel. Today, we're going to talk about baby making part 2, tips on getting pregnant from a fertility doctor. I'm Dr. Lora Shahine. I'm a reproductive endocrinologist helping people build families for over 15 years. And this is a follow-up video from my baby making sex tips on how to get pregnant. You guys have asked so many great questions on how to plan, what to do, how to get pregnant. I wanted to follow it up with more information for you. So let's get started. So there's 5 big areas to think about when you are really getting ready to start trying to get pregnant. Number 1, plan ahead. And I mean this in 2 different ways. First of all, if you're on birth control, think about when to stop your birth control. If you're on a long-acting form of birth control, something like Depo-Provera, which is the shot of progesterone on the arm that you get every 3 months, it can actually take 3, 6, sometimes a year for your body to start ovulating again after you stop that. Other types of birth control, like birth control pills, when you stop them, you could ovulate a couple of weeks later and even conceive really quickly. So think about the birth control type that you're using and kind of plan ahead as far as when you want to try to conceive. Another part of planning ahead is if you have chronic medical conditions, if you're taking prescription medications, if there's something about your health that you want to optimize, think about doing a preconception visit. I strongly recommend that for people with heart disease, high blood pressure, prescription medications. You just want to think about how you're going to manage your medications, make sure your health is optimized before you actually get pregnant. Number 2, when you're thinking about how to get pregnant and kind of tips for me on how to make this happen, start learning about your menstrual cycles. Start tracking them and start trying to figure out when you're ovulating. So just stopping a birth control method and then just sort of hoping that it happens, well, that might work for some people, and that is fantastic. But it can be pretty frustrating if you realize, wow, I stopped my birth control 6 months ago, a year ago, and I'm not pregnant yet, and I don't even really know my own cycles. Like, this is not something that most women learn in health class, although we should. And so learning about your cycles, knowing that your cycle is typically 28 days long or 32 days long, learn this. And you know what? If you are not having regular menstrual cycles about 3 to 6 months after stopping whatever birth control method you're using, then get an evaluation, like figure it out. You need to ovulate in order to have a regular, predictable monthly menstrual cycle. And so if that's not happening for you, you might not be ovulating. And it can be so frustrating to figure this out a year or 2 into trying to start your family. And you can really wish you'd figured that out sooner. So get a calendar, paper calendar, just kind of mark down when you get a period and then sort of look over a couple of months. Other ways people track their cycles are sometimes with basal body temperature taking or ovulation predictor kits, or they'll find an app that they like to kind of keep track of. But just really learning about your cycles, sometimes you can even learn when you're ovulating with ovulation predictor kits or physical signs like a change in cervical mucus. There's an excellent book that can teach you all about your cycle and learning about your body called Taking Charge of Your Fertility by Toni Weschler. This book really revolutionized and taught so many people what cycles were like and how to figure out their own body and their own cycles. So that is a huge part of how to get pregnant and tips from this fertility doctor. Number 3, you're planning to get pregnant. It's time to kick some habits that might not be ideal for your overall health. The healthier you are, the more fertile you are. So things to stop is absolutely smoking and vaping. Alcohol should be a celebratory thing, should be every once in a while kind of thing, but daily alcohol consumption is not good for your sleep. It's not good for your overall health. Time to really look at some habits that you have and try to optimize your health. Number 4, you think about starting some healthy habits. If you're already healthy and you feel great about what you're doing, fantastic. But just remember, the healthier you are, the more fertile you are. So think about moving your body, not to extremes, but just kind of get into an exercise routine. Think about your nutrition. Think about what you're eating, less fast food, more fruits and vegetables. Protein is important, but more from plants than from animals. I have lots of information here on YouTube, on my website, other social media channels. You can follow me on Instagram and TikTok. I really like talking about lifestyle modification to optimize fertility, but in moderation. So if you can eat well, move your body, get sleep, take care of your mental health, just, try to really focus on you and self-care. If you can do that 80% of the time, that is perfection. So, nothing in extremes, and just be really kind to yourself. Take care of yourself, nurture yourself, and try and be healthy. It's also a great time to start a prenatal vitamin. And also consider vitamin D. I practice in Seattle, which is in the Pacific Northwest. We do not get enough sun. And so I talk to my patients about a good prenatal vitamin and vitamin D. The thing in prenatal vitamin that's really helpful is folic acid. So getting an adequate amount of folic acid in your diet or in your prenatal vitamin will decrease the risk of birth defects in the baby. So spine and brain defects. And it's important to have that on board early in pregnancy. So it's nice to kind of start to get into the habit now of being as healthy as you can, taking that prenatal vitamin, moving your body, getting sleep, mental health. All of those things are beneficial for your fertility. All right. So the fifth thing, so you've done all the things. You planned ahead, you've stopped your birth control, you've had a preconception visit if you needed to, you've learned about your cycles, you're pretty sure about when you're ovulating, you've kicked some bad habits, you've started some good habits, you're taking your prenatal vitamin, all the things. Well, then it's like, okay, how do you actually get pregnant? I have a whole video on this. This is the baby making sex video where we talk about timing of intercourse, how often to have intercourse, positions after sex, all those things. So go there for details. But the summary is you are fertile 6 days around and before ovulation. The fertile window is actually the 6 days before you actually ovulate. The egg is viable for about 12 to 24 hours after ovulation, but sperm can live in the reproductive tract and find that egg for up to 5 days. And so you want to have intercourse 2 or 3 times in that fertile window. So you don't want to wait until you're like, oh, I'm sure I ovulated yesterday. Now we should start having intercourse. You should have it a couple of times before you think you're actually going to ovulate, so you don't miss that window. You don't have to have intercourse every day. Some people do, but about 2 or 3 times in that fertile window is the way to do it. Position of intercourse, standing on your head after intercourse, keeping your hips up. These things do not improve your chances of success. Sometimes people want to do that because they feel like they're doing everything that they can, but the evidence does not support it. So go to that baby making sex video for more details, and I go into the evidence surrounding these recommendations. I hope this video is helpful. If you are getting ready to get pregnant, it's all about planning ahead, being as healthy as you can within moderation, taking your prenatal vitamin, having a preconception visit, thinking about medications and being healthy in pregnancy, learning about your cycles, timing things well. And I hope that this information helps you get pregnant when you are ready. Like this video if it was helpful, comment with questions that you have, topics you want to cover, subscribe to this channel, and stick around for more learning.